Vaccination. It's an easy way to prevent all of these horrible diseases you've just seen. Herd immunity is a phenomenon which occurs when a certain percentage of the population gets vaccinated. Once this occurs, those who are not vaccinated are much less likely to become sick due to less frequent contact with the disease. This percentage is in the upper 90s and is different for every vaccine-preventable disease. This data is reported to and recorded by the local Department of Health. The mission of the Florida Department of Health, Orange County, as stated on their website, is to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. 10 essential services are also listed. This problem and solution I will identify for you today hits all 10. Working at the Florida Department of Health, Orange County, I've seen where some of these goals fail. According to a study done by the CDC between 2006 and 2011, Florida did not meet the safe vaccination coverage for diphtheria, pertussis, mumps, measles, or rubella. This means that herd immunity is very low in our state. Orange County in particular is seeing the effects of this lack of herd immunity, as outbreak-associated cases of pertussis have increased by over 700% in the past 5 years. The question I propose today is, how can the Florida Department of Health, Orange County, significantly increase herd immunity in Orange County? The solution is an interdisciplinary one, so before I dive into it, I'd like to talk about the significance of interdisciplinarity in this solution. An interdisciplinary solution, as defined by Julie Thompson-Klein and William Newell in their book, Handbook of the Undergraduate Curriculum, a comprehensive guide to purposes, structures, practices, and charge, is a solution that draws on disciplinary perspectives and integrates their insights to produce a more comprehensive perspective. This means that just one discipline, like epidemiology, infectious disease microbiology, or community health, does not have the resources in itself to solve the problem. Sure, this problem requires knowledge about the vaccine coverage needed in a county for each disease to determine the level of herd immunity, but it also requires cultural awareness, new technologies, and policy implementation for this solution to come to full fruition. The major problems which are causing this lack of herd immunity are mostly compliance problems, which stem from both religious beliefs and philosophical beliefs. Some of these philosophical beliefs are not founded in science, and are similar to the following statements. I still get sick from what I was vaccinated against after being vaccinated. I get sick from the shot. Vaccines cause autism. Vaccines are unsafe because they contain mercury. And the rare side effects from the vaccine are worse than the disease that it's protecting against. Again, these beliefs are not founded on scientific evidence. Other problems include that vaccines could be made more effective through several routes, including the implementation of self-boosting vaccines, the use of highly conserved epitopes in vaccine synthesis, and a new delivery route such as the nanopatch. Though some of these problems can be solved through disciplinary bench research, such as improving on vaccine effectiveness and delivery, others could be mitigated by an educational course required by the state for those who wish to exempt themselves or those under their care from vaccination. This class would need to touch on each of the previously stated points in order to be effective for all exemption seekers. The implementation of such a program would require the cooperation of scientists, educators, public health officials, and policymakers. This kind of interdisciplinary cooperation would be difficult, but the results would be well worth the work.